Hello, it's Dr. Rhonda Johnson, and today is Saturday, December 17, 2022. And today I'm talking about a COVID-19 personal plan. Now, I want to just clarify, you don't want to plan to get COVID. You want to do everything you can to prevent COVID. But if you find yourself testing positive and you're sick with COVID, you will really appreciate the fact that you have planned in advance. So again, you're not planning to get COVID, you plan to prevent COVID, but it's a very hard to avoid COVID in some circumstances. So have a plan in case you get COVID. Now, you can download this plan from the CDC's website, and I'll reference that link, but basically, here's what the CDC recommends: that you talk to your healthcare provider to know your risk in advance. And I would think 3 years into this, people should know their risk if they get COVID. Also have a test supply at home and know when and how to use them. Basically, you use them if you feel sick or if you've been exposed 5 days after your exposure, 3 to 5 days after your exposure. Now, they also have a recommendation that you have a healthcare provider who can advise you on whether or not you need to get the Paxlovid treatment, because treatment has to be started within the first 5 days after you first develop symptoms. They also have a link where you can help locate a provider and a test to treat location. Then the next section is taking precautions, having the vaccines and boosters, having ventilation maximized, that you're opening up a window and improving air quality indoors through air filtration. Of course, they recommend masks for indoor use and knowing your community COVID-19 levels. But folks, don't wait for that because by the time you know your community COVID-19 levels, you may already have COVID. So the other thing is recognizing COVID-19 symptoms, and by now people should know what these symptoms are. Basically, they're very similar as the flu, although you may have different symptoms with COVID and a new loss of taste and smell. Knowing the emergency signs for COVID. Those are trouble breathing, persistent pain or pressure in the chest, new onset of confusion, difficulty waking up or staying awake, having pale gray or blue colored skin, lips or nails. Now keep in mind, if you're dark complexion, you may not see that. And again, knowing what to do, how to get emergency care. Call 911 if you need to. Now, the other thing is, if you have symptoms, knowing when your symptoms start. If you test positive, keep track of that, folks. A notebook comes in handy. If you're exposed to COVID, know the date of your exposure. And they recommend that you get tested at least 5 days after you were exposed, and you watch for symptoms for 10 days. Things to consider if you're sick, such as transportation, where you're going to isolate, what kind of help will you need at home, or child care, pet care, what food items will you need, cleaning items, hand sanitizers, over-the-counter medications, mask, and how will you have your prescriptions if you're on medication. So it's actually a very good plan, folks, and I hope you'll download it. I have my plan here. I downloaded it from the CDC website. Haven't filled it out yet, but it's a good idea to do so. That's my message today. It's Dr. Rhonda Johnson. As always, I hope that you'll be safe and have a great day.